And of course, youth suicide in Australia is at its highest rate in 10 years, and across the country, governments are scrambling to address the national crisis.
And as politicians look for solutions, youth advocates are wanting them not to violate the privacy of young people.
In 2014, 383 people up to the age of 24 committed suicide, according to the Australian Bureau of Statistics. The next year, that figure rose to 405. For every death by suicide, it's estimated that as many as 30 people attempt to end their lives. That means that in 2015, there were 12,000 failed suicide attempts by young people. In New South Wales, the government wants to implement new measures whereby a GP can share a student's detailed mental health records with teachers, parents and school counsellors. The government says that it will help teachers and the school community provide students with more support. However, some youth advocates are against the move, arguing that it strips young people of their privacy and limits them from making decisions about their own mental health. But given the rising rate of youth suicide, can you blame governments for wanting to take drastic action?
To answer that question and more, we have Katie Acheson from Youth Action joining us. Katie, welcome to the feed.
Thanks for having me. Very excited to be here.
Now, the New South Wales government want to include schools and teachers in caring for the mental health of their students. You're against this plan. Why?
No, not against teachers and GPs being part of good mental health for young people. What we're against is the idea of sharing information without a young person's consent. So what you really want to do is talk to a young person, involve them in the process, and then get all the people around who need to support them. So teachers and GPs will probably be part of that, but it should involve the young people. And this plan isn't involving the young people. Those people can talk without the young person being in the room, essentially.
There are similar plans to this in Victoria, for example, where they do involve consent. So you'd need the consent from the young person before you pass it on. I think that's what you guys are after.
Yeah.
The current plan would involve, or the proposed plan rather, would involve kind of lifting that consent out of the equation. So what are your concerns with that? What are the knock-on effects that you're worried about?
Well, think about Sam going and talking to their GP and saying, I'm having, things are a bit difficult, I'm not having a great time at school, things are a bit hard, and then the GP just going, oh, I'm going to call the school and just talk about Sam without her knowing about it or him knowing about it. Those are really concerning things because young people really need to trust an adult to get support. We want to make sure that there are no barriers for young people to seek help, whereas when you take away that trust level, a young person is going to be less likely to come back to that person, and that's a really bad thing. We want young people to have the supports that they need, and so we need that trust level to be there. So it's kind of removing it by allowing them to talk without that person's knowledge.
What are the actual circumstances under which this information can be shared, though, and who can it be shared with? Is it only an emergency still, or...?
No, that's the problem. This doesn't actually specify that. It could be just that I'm having a bad day, and then they can remove all privacy and all confidentiality. That's not a good thing. We already have, if somebody is at risk of suicide, that doctor already has the right to go and seek help for that young person. So we already have things in extreme cases where there's risk of harm. Those things are already there. This is extending those boundaries to be a little bit blurry about saying, I can share information whenever I feel like it, and the young person doesn't have to be involved. And that's really problematic because young people should be at the centre of this conversation.
So there is a school of thought that would suggest that suicide prevention trumps everything, trumps privacy, trumps consent, trumps a whole bunch of things. What would you say to a person that holds that view?
Absolutely, we can prevent suicide in Australia. The numbers that we have are ridiculous. It's an epidemic and we have to do something. And so the government trying to get more people involved is great. What we can't do is remove young people from the centre of this conversation. This is not about suicide prevention. This is about sharing information without consent. And that's what we don't want. We do want more services. So at the moment, in most states and territories, they spend less than 10% on children and young people's programs to support them. We need to spend more money on those young people, more programs that will reach those people, because rural and regional young people, LGBTQI young people, Aboriginal young people are their highest suicide risks than even the general population. So those guys aren't having enough programs that are there to support them, and there's a really long wait time. So we need to address those things before we just start taking these consent issues and removing it and thinking this is going to solve the problem. It's not.
Katie Acheson, thanks so much for talking to us.
Thanks,
really
guys.
appreciate your time.